So guys, today we're going to be touching on stretching and foam rolling 101. I get a lot of questions about stretching as well as foam rolling, such as when should I do these? Should I be doing these before I work out, after I work out, throughout the day? If so, how much? How long should I be holding stretches for? How long should I be foam rolling? And then also questions regarding injuries. Should I be, what stretches are the best stretches to fix knee pain, or what are the best stretches to fix shoulder pain or low back pain, or what's the best foam rolling techniques to decrease various types of pain? And then also, we're going to be touching on an even more important topic too regarding is stretching and foam rolling actually going to help treat the root issue of if you're dealing with pain, is it actually going to address the root issue, or is it just treating symptoms that you're experiencing in the pain? So, want to start off by starting with the number one question with regards to stretching. So, should I be doing stretching before or after I work out? So, ideally, you want to be stretching afterwards. When we're warmed up and our muscles have blood flow, they're much more responsive to stretching, and it's going to create longer lasting changes of the tissues versus if we try and stretch before we work out. A good example of this is like if we have like meat in the freezer and we take out that meat and you try and like expand that or stretch that whatsoever, it's not going to do a whole lot, right? But if it's thawed and it's warmed up, you can stretch that meat much more effectively. The same thing with muscles. So ideally, we want to be stretching or ideally after our workout as well. And then with regards to foam rolling, I like to do foam rolling before I work out, and this is consistent with what the research shows. This stuff right here isn't just my personal opinion or bias. Everything that I do or communicate with you guys is all backed on what does the current best research show, and that's consistent with the stretching that I just talked about. And then foam rolling, what foam rolling does is it actually helps promote blood flow and can help loosen up some tissues as well, and can decrease some pain for the time being. And so I like to do this before I work out. Helps kind of get the blood flowing, gets me warmed up a little bit, kind of mobilizes some different joints and musculature. And so ideally doing foam rolling before and then stretching at the end or after your workout. How much should I be foam rolling? So you shouldn't be. I see a lot of people mess this up where they're foam rolling for more than 2 minutes. Like I had a patient come in, made this mistake when I was earlier in my career where I had told a patient she was dealing with some knee pain, and we were working on. She had really tight quadricep muscle on the front of the thigh, and I told her to go home and do some foam rolling on the thighs as well as some various other exercises. And she came back the next session. She's like, my thigh is so sore, and I'm like, okay, how much foam rolling did you do? Oh well, I was watching TV and I foam rolled the quad for about 20 minutes. That's the reason that she was sore. Like that's too much. So now I make sure I don't make that mistake and make sure I discuss on how long you should actually be foam rolling. So ideally 1 to 2 minutes per muscle group. Okay, it shouldn't be a whole long duration. 2 minutes tops with that. Okay, and then also with regards to stretching, how long should I be holding stretches for? So they did research where they did 5 second holds, 10 second holds, 15 second holds, 30 seconds, 1 minute, 5 minutes, and 10 minutes. It showed that the 30-second time frame was the most efficient way to stretch. Did we get improved stretching when it was held for 10 minutes and 5 minutes? Yeah, compared to 30 seconds, yes, but at the same time, there was diminishing returns after about 30 seconds. So it wasn't really worth that time. You're better off doing 3 second holds, 30 seconds. Okay. And again, after your workout. So that's a kind of a good framework for stretching. Another thing I want to address is stretching. Is there like a best stretch for knee pain, or is there a best stretch for shoulder pain or anything like that? Not necessarily. There's so much different things that can be going on. With regards to the knee, shoulder, and low back, that without an assessment, it's literally impossible to figure out which stretch is going to be the best for knee pain. It's a very general term. But I also get the question on, um, like a lot of people think, and this is totally understandable. I thought the same thing too until I got into physical therapy school and did more continuing education. I thought that, yeah, if I just did like stretching, that's gonna, if that's gonna be the thing that treats the issue that I'm dealing with. So I get a lot of questions like, oh, or that people that think that they just need to figure out, find the right stretches to do, and that their pain's gonna be gone. That's not necessarily the case, and that's where most people go wrong. And the thing that I hear all the time, before I had anybody ever come in to see me, or see us for treatment, I always hop on a phone call with them for about 10, 15 minutes to make sure they're a good fit and whatnot. And one of the most common things I ask is, what have you tried and what has helped, what hasn't helped? And 9 times out of 10, people are like, I've been doing a lot of stretching, and it helps for a little bit, maybe a day or two, and then it comes right back. And that's the thing is, we got to figure out why is that tissue getting so darn tight in the first place, because the stretches are really just treating the symptoms. Usually the pain that somebody's experiencing is due to tightness. So I'm going to use the example for let me use the example, of the quadricep muscle. Okay, the quadricep is responsible for a lot of knee pain. All right, and so if we loosen up that quadricep muscle, there's a lot, usually people get significant relief right away. However, we got to figure out, why is that quadricep getting so dang tight in the first place? Because if all I did was give patients stretches and foam rolling for the quadricep muscle, they would literally have to continue to do that day in and day out for the foreseeable future to continue to get pain relief. And that's not reasonable. Like, and that's another question I get from my patients, like, do I have to do these exercises the rest of my life? Like, well, it depends. Are you just going to do stretching and foam rolling? If that's the case, then yeah, you're going to have to keep doing these exercises, because you're not addressing the root cause. Stretching isn't going to address the root cause. Usually the root cause is muscle imbalances, okay, and immobility in certain areas that feed off one another. So for example, um, if we're able to find the root cause, and usually it's a strength issue. So for example, if somebody's dealing with really tight quadricep muscles, it's usually because they're not utilizing their hamstrings and their glutes like they're supposed to, or the way that they're doing lunges or squats is more of a quad dominant movement pattern, and they're overstressing the quads. And when the quads get overstressed, they get tight. So then what we do, we stretch and foam roll to get them loosen up. They feel better. Then guess what? The next time we go back to squatting incorrectly, or doing lunging correctly, or not strengthening up their hamstrings and glutes to start taking off some pressure of the quads and demands of the quads, it's just going to keep getting tight over and over again. Right? So if you don't remove the thing that's causing it, you're going to have to keep doing stretching and foam rolling. The root answer, and what people should be asking, instead of what are the best stretches or what is the best types of foam rolling to do, or foam rolling techniques, they should be thinking about assessing and figuring out what the actual root cause of it is, and figuring out where these muscle imbalances are with regards to strength and weakness. Okay, that's going to help get the long-term solution overall. Okay, so number one, assess, don't guess. And two, get to the root cause. Don't just keep throwing stretching and foam rolling. Don't get me wrong, stretching and foam rolling is great. But if you're dealing with an injury and expecting stretching and foam rolling to get you over that injury, it's most likely not going to happen. I don't want to be the bearer of bad news, but I see it way too often that people get in this go in the rabbit hole of trying to find the best stretches and foam rolling, and they're not barking up the right tree with things too. Okay. Trying to think if there's any other. One other question I get is, does stretching and foam rolling prevent injuries? It can. It can. Absolutely. But the thing that's going to bulletproof the body and prevent injuries more than anything is having strong supporting musculature that's strong, stable, and that's what's ultimately going to prevent injury. Stretching and foam rolling do serve their purposes and have their place, but really making sure that there's no asymmetries throughout the body. Okay, that's assessing and not guessing. Looking at shoulder range motion, or looking at knee range motion, ankle range motion, and looking for symmetry. The body likes symmetry. Research shows that if we're better off having two equally bad ankles when it comes to range of motion than having one that's good and one that's bad. That's how important how important symmetry is. Okay, so that's the thing that's going to really prevent injuries, is making sure we're as symmetrical as possible. We have good movement patterns, and we have the right strength to support our joints and our body with whatever activity that we're trying to do. But yeah, stretching and foam rolling can help, especially if you do have muscle imbalances where you have one ankle that's tighter than the other. If stretching and foam rolling the ankle and the musculature around it, to make it more symmetrical, that's ultimately, yes, going to decrease your risk for injuries. But that's only stretching and foam rolling is only a piece of the puzzle. So that's kind of my spiel, kind of on stretching and foam rolling. Okay, you guys probably think that, oh, I'm against stretching and foam rolling. No, I'm totally for it. It's just I don't see it overutilized, and people become too reliant on it and expect that stretching and foam rolling is the thing that's going to cure them of all their pains and injuries, or prevent injuries, or just treat or fix all their problems. And rarely ever is that going to be the case. So stretching foam rolling is great. Just don't be too reliant on it, and it's not a fix all type of thing either. Okay. So that's stretching and foam rolling 101. There's a lot of different things that we can talk about. I could get into all these different types of stretches for the knee, low back, and shoulder. But that would literally take me probably 5 hours. So I just wanted to give you guys a brief overview of stretching and foam rolling, and actionable stuff that you guys can utilize right away. So for example, make sure you're stretching afterwards, foam rolling beforehand, and then make sure that you understand that stretching and foam rolling isn't necessarily going to 100% prevent injuries, and stretching and foam rolling isn't the overall final answer to overcoming pain and treating the root cause. Okay, guys? So hopefully you found this beneficial. If you guys have any questions, just let me know. All right, thanks, guys.